Whether you are a week postpartum, 1 month, or 1 year, sleep is so important to new mothers for their mental health, healing, and mood. Today, we are talking about the mamas and how they can get a good sleep routine. Thanks for joining us. This is Newbies.
He's gorgeous.
It's a girl.
Surprise! The whole family's here.
So when are you having the next one?
It's just poop.
Ready for another?
Wow, you look really tired.
Ready to go back to work?
Yellow poop? Seriously?
Did you sterilize this?
Sex? Now? You've got to be joking.
You should sleep when the baby sleeps.
She doesn't look anything like you.
I thought you already had your baby.
I did.
Babies don't come with instructions, so there's Newbies, helping new moms and new babies through the first year.
Welcome to Newbies. My name is Kaylee Garcia, and I'll be your host today. If you haven't already, be sure to visit our website at newmommymedia.com and subscribe to our weekly newsletter, which keeps you updated on all the episodes we release each week. Another great way to stay updated is to hit that subscribe button in your podcast app. And if you're looking for a way to get even more involved with our show, then check out our online community. It's on Patreon. That's where we chat more about the topics discussed here on our show. We post blog posts outlining every episode we record, and it's also an easy way to learn about our recording so you can join us live. Our expert today is Gustafson. She is a licensed clinical psychologist specializing in perinatal mental health, pregnancy and reproductive loss, and the transition to parenthood. As both a psychologist and a mother, she brings professional expertise and personal understanding to this work. Yes, we love moms. Please tell us about your family and where you are located.
Hi, so I am located in the Los Angeles area, and I have two girls, a 2-year-old and an almost 5-year-old.
Oh, perfect. That's like my girls. I have,
Aw.
what's their age gap? Is it 3 years or more like 2.5?
It's closer to 2.5.
Well, same. Yeah, I have a March baby and a September baby, and they are literally 2.5 years apart, which
Yeah.
is fun. That's a fun age group. I didn't want to do the 2 under 2. I wanted
Yeah.
more of like a 3-year age gap, but we got 2.5, and I'm happy with it. That's a good age gap. Yay. Well, we will definitely dive into today's topic, but first, let's take a quick break. Welcome back. Today we're discussing sleep tips for new mamas. So for our listeners, I want them to get a picture of who you are. Tell us about your journey becoming a mom, pregnancy, birth. How was it? And we love experienced mamas too. So how had it shifted from, welcoming your first to welcoming your second? So first question, how was your pregnancies?
Yeah. So my first pregnancy, I got pregnant, within a few months, and things went well up until close to kind of like the third trimester. Ended up getting gestational diabetes, which was a shock and a big learning curve. And then I did have something of a complicated, difficult, traumatic birth with my first.
Aw.
She had a nuchal cord, meaning that it was wrapped around her neck and body, and she was also breech. So
Oh,
we were
gosh.
planning to do a C-section anyways, but she, for people that have had higher risk pregnancies that are listening, they might be familiar with like non-stress tests. We were going in a lot for the non-stress test because she wasn't very active, which was concerning. She wasn't doing very well. We ended up doing, I kind of call it like an urgent, if not emergent kind of C-section because she wasn't doing very well. And that really changed my relationship with pregnancy, having kind of gone through that. It made me feel very scared, right? Like with this idea that she could be like in my body, but not safe in my body.
Yes.
As I went on to have another baby, and in between my two daughters, I also experienced a series of pregnancy losses, which is one of the big things that brought me to kind of specialize in, maternal mental health. So I experienced a series of pregnancy losses before then going on to have my second daughter. But that pregnancy was more difficult, kind of emotionally, just kind of like having had the losses and then also the traumatic birth. And so for me, in that pregnancy, I really didn't feel safe until she was like here, and like out of my body. But she did make it here and actually arrived basically the same time that we experienced kind of one of the major kind of pregnancy loss that we had. So I'm very grateful to have my rainbow baby.
Oh, that's so special. And I can imagine I had a very smooth, I would guess, I would say labor. But with pregnancy, I had HG. So I was very,
Yeah.
very sick with
Ugh.
both my pregnancies.
Yeah.
And I can imagine that, overall, it gave me a different perspective with my first on like feeling like she wasn't safe in my body because I wasn't feeding myself because I
Yeah.
couldn't.
Yeah.
It's very
Yeah.
difficult. And so I can totally relate to you on that front. And then that changes when you have your baby earthside, right? It
Right.
changes the mentality of like, I prayed over you. I wanted you, I tried really hard. I like, fought my body for you. And then the
Yeah.
relationship with sleep, right? Because it's such a mind game. Here you
Totally.
are, hoping that your baby is going to be okay. And then they come and everything's fine, for the most part. And then the sleep happens, right?
Yeah.
And so I feel like it goes hand in hand, honestly, of just the mental mind games back and forth. So I guess jumping into next question, once you had your first or even your second, did you struggle getting sleep postpartum? I feel like let's jump in with the first, honestly, because I'm sure the answer is different. But with your first, did you struggle getting sleep postpartum? And
Sure.
not, we have episodes on baby sleep. Obviously, you can touch on that, but specifically for yourself, once baby was sleeping better, were you sleeping better? I want to know your personal
Yeah.
experience
I
with
think
that.
sleep is like a major kind of topic for me, part because it does play such a big role in regulating our mood.
Hmm.
And it's very difficult postpartum, right? And like people kind of, and this is like one of the things that bothers me. People have this idea that like postpartum depression, for example, is like just something that's hormonally driven. And like, well, hormones can play a factor. Actually, sleep plays a big factor. And people don't seem to have that same kind of understanding or awareness. But one of the biggest things that you can do to protect your mental health postpartum is to try to prioritize sleep and to try to get what they call anchor sleep, which is like 4 hours of consecutive sleep. The issue with that is that that can be hard to come by postpartum, especially with a newborn if you're breastfeeding. And so, one of the things that I really work with people on, especially people that are susceptible, have risk factors and things like that, maybe a past mood or anxiety disorder, is like, what is your plan for sleep? And not a plan for the baby, but like a plan for you and your sleep. And are you having, if you have the resources, like a night nanny, or are you and your husband going to take shifts? Or is there, family that can help? Because I remember, right, like in preparing for my first, taking like a breastfeeding class and hearing that, oh, your baby's going to nurse approximately every 2 hours, like 24/7, right? But like you can hear that and understand that kind of conceptually. But hopefully, right, you've never had the experience where you are only, sleeping in 90-minute increments, 24/7 for weeks or months on end and experiencing the impacts of that. But sleep plays such a big role in regulating our mood, and it's one of the most important things I think that moms can try to prioritize with as a way of protecting their mental health.
Absolutely. And so when you work with clients, what are some common struggles new moms face when trying to get good sleep? So obviously I can imagine the colic, right? Colicky baby is very difficult, and also breastfeeding struggles. That was me
Yeah.
my first time around. I was waking
Yeah.
up every 2 hours round the clock for at least 4 months. And so what are some other common struggles that new mom face that you've seen firsthand?
Yeah. I think it's really the tension between kind of sleep and feeding, right? So
Mhm.
like if you are exclusively breastfeeding. And if you don't want to introduce a bottle until that's been well established, then it really puts a lot of pressure on mom, and it's going to have the biggest, impact on mom's sleep. So mom needs to be really supported. And, that could be that dad is doing everything else at night, right? Including maybe like bringing the baby to mom for feedings, or maybe it's a night nurse or something like that. But that mom is being supported as much as possible. It's really important. But for some people, like it's going to have such a big impact that maybe breastfeeding, doesn't make sense, or they want to, maybe they're going to pump and introduce a bottle earlier, or if mom is especially at high risk, right? Like, and there's lots of medications that you can be on and still breastfeed. But for certain kinds of conditions, like, if there's bipolar disorder or anything that might give rise to concerns about kind of like episode of psychosis, things like that, like mom's sleep is number one priority. And so maybe it just means that like mom is protected in terms of sleep and on medications that she needs to be on, and formula is how we're feeding baby, and that's how the family is going to function.
That is so important. And I love that you touched on mental health too, right? Because yes, I feel like, and have you noticed anything like during pregnancy, does mental health concerns become more clear, or do people get diagnosed during pregnancy,
Sure.
postpartum? Is that, I feel like maybe because there's so many appointments, basically is what I'm hinting at. You have so many appointments in pregnancy. And so maybe you're more open to talk to your OB, who can basically tell you like, yes, talk to your PCP. You know what I mean? So is that pretty common to happen during pregnancy and postpartum?
Yeah, so like postpartum or perinatal, and perinatal, if people are not familiar, it means pregnancy and postpartum. So
Oh, nice.
it's
Yes.
during that period of time. And yeah, perinatal mood and anxiety disorders are actually the number one complication of pregnancy.
Hmm.
So it affects like, some people will say like 1 in 5 or 1 in 7 women. And also, it does not just affect moms, right? Because it is not just kind of like a purely hormonal kind of phenomenon. Whenever we're talking about mental health, we're talking about biological factors, psychological factors, social factors too. And during the perinatal period, all of those areas are being, you know, disrupted, right? Your sleep is disrupted. You're experiencing major changes in your roles and responsibility. And then, of course, we also have kind of, the hormonal changes and the brain changes. So it is a very vulnerable period. And that's one of the reasons that protecting sleep is really important for things like postpartum depression, or certainly if there's a risk factor for kind of, more severe kind of perinatal mood and anxiety disorders. And anxiety is another one. And it's,
Hmm.
new moms are going to have some anxiety, or even, experienced moms are going to have some anxiety. But if you're not able to sleep, even when the baby is sleeping because of anxiety, that definitely warrants attention and getting support, right? So that you can feel safe enough to sleep, because you really do need to be sleeping in order for your mood to regulate.
I so agree with that. And that kind of jumps into my next question, is why is it so important for hormones, specifically at night, to relax? And I know you're supposed to put your phone down, right? Not binge watch Netflix. You're supposed to
Yeah.
really have a calming environment. That way it helps, your brain to tell itself, hey, it's time to go to sleep. But on your end, why is it so important to relax? And then if women can't relax at night, what would you suggest to them, that they are in that fight or flight? You kind of mentioned if baby's sleeping and you're not sleeping, that's kind of a red flag. But what are some other things that you would mention?
Yeah. If anxiety is interfering, right, in your ability to like sleep, or if it's causing significant distress, if it's, you know, interfering in your ability to function, that's the time to get connected to support like medication, like therapy. And I'm a big fan of being really proactive with that stuff. So, don't wait till you get to that point to like try to find people to connect with. I really think it's wonderful because it is such a vulnerable time with, the physiological kind of changes in terms of hormone and the brain changes and the changes to your life and the sleep deprivation and all of that, to be proactive about getting support. Even if you just, kind of like touch base with somebody and establish care with a therapist, or if you know that you have a history or risk factors for perinatal mood and anxiety disorders, like a history of depression or anxiety or trauma or other kinds of stressors, to get connected to care kind of proactively instead of waiting till it gets to that kind of point, because the last thing that you want is to be experiencing, a high level of distress and then have to kind of figure out where to go. Ideally, you kind of have support, know where to go. Maybe you've touched base with somebody, or maybe you're, already taking medication if you're at risk, and it doesn't have to get to that point.
I think that's so important because I can definitely imagine the late nights of sleep deprivation and my husband snoring
Mhm.
next to me. And it gets really isolating, definitely. And I think you put it perfectly. I know it'd be harder to ask for help, once it's down the line and it's been a few weeks and you're like, it's not getting better. Anyway, we'll jump into
Yeah.
more questions, but first let's take a quick break. Welcome back. We are continuing our topic. So let's chat a little bit. You've dropped so much important information. Let's talk about working with you. How can you help assist new moms who are struggling with quality sleep? I guess what would be your guidelines, your, how to, what would you suggest for those
Yep.
who want to work with you?
So I actually have available on my website a free postpartum guide
Ooh, nice.
for moms, and anybody can hop on and download that. Like I said, it's for free, and it talks about ways of protecting your mental health postpartum. So everybody, has like kind of like a birth plan and that kind of thing. But I really am a big fan of having a postpartum plan. And the very first topic that I cover is sleep because it is such a big factor when it comes to regulating your mood and such a big factor when it comes to kind of like mood and anxiety disorders. So you really do want to create a sleep plan. And that's one of the many things that I walk you through in that postpartum kind of guide or workbook. So I would encourage people to definitely do that. And then I also have on my website an online course for parents. It's kind of based on my book, Reclaim Your Life Acceptance and Commitment Therapy in 7 Weeks. But the course is Reclaim Your Life After Birth. And so it specifically walks, you know, parents who are pregnant, postpartum, new in kind of the parenting space through the processes in acceptance and commitment therapy to help support their mental health. And then, of course, I also offer individual therapy. And if you're interested in working with me one on one, you can fill out the contact form and get in touch with me.
I love that so much. I love all of the guides you have out. I feel like that's so helpful for the moms who are not sleeping, right? Because you're already up at 11 p.m. to 1 a.m. to 3
Yeah.
a.m., so you're already doom scrolling or researching whatever it is.
Just to touch on anxiety a little bit, because I do think it is so important. And I do think, like I said, like all new parents are going to experience some anxiety, but if it's causing a lot of distress, if it's interfering in your functioning, if you're not able to sleep as a result of it, even when your baby's sleeping, if you're feeling constantly in a state of kind of, hypervigilance and hyperarousal, that's not helpful for you and it's not helpful for your baby. It's not keeping them safe. We don't want to be doom scrolling and that kind of thing. We want to really adopt a present focused and action oriented approach. So, of course, practicing safe sleep and those kinds of things, but focusing really on like what's in your control and not getting lost in kind of future fears or imagined fears or doing the kind of doom scrolling that you talked about that really just amplifies those imagined kind of fears.
I would say yes.
Yeah.
I actually got it back into reading after my first
Mhm.
because I wanted to stop doom scrolling, right? And so I would put the caps on my phone for like Instagram, Facebook. I was never really a big TikTok person, probably because I'm an older millennial. But, so I never got into TikTok, but I would actually switch to Kindle. So I had an iPad, right? I switched it to the Kindle app and I actually started reading and I since welcoming my second, I love it. I hit my book goals. It makes me sleepy, I just
Mhm.
that's what I've switched to and I've loved it. Speaking of what I've switched to, what would be your tips for getting into the mindset of creating like maybe a sleep routine? We talk about that so much with babies, right? And not even babies,
Yeah.
like newborns, babies, toddlers, right? Children, back to school sleep routine. But I feel like I've never really talked about it as like a mom,
Yeah, but it's
like
important.
it
Yeah,
is. So
for
what would
sure.
be your tips for like
Yeah.
creating a good sleep routine for mom? And obviously in the different cycles, right? A newborn's way different than the
Yeah,
4 month sleep progression than the year old. But in general, what would be your tips?
totally. Yeah. I mean, it's so funny because I feel like so much of what is true for babies is true for like adults when it comes
Yes.
to, like just like these kinds of practices, right? But like, yes, you absolutely want like a wind down routine. Generally, they say that should be an hour, right? Where you're, staying away from screens, you're doing activities, and it's like a consistent routine, right? And you probably already have something of a routine that you're doing, but brushing your teeth or washing your face, putting on your pajamas, staying away from screens and staying away, especially from, you know, doom scrolling or anything that's too stimulating, doing something calming, relaxing. I'm a big fan of meditations, and especially for sleep. I think body scans can be really great, but there's all kinds of meditations for sleep, our mindful movement, maybe some gentle stretching for sleep. I love using like magnesium lotion. I always put like magnesium lotion on my feet. And that's something that's like safe for pregnancy. And especially in the third trimester, right? People are uncomfortable, and a lot of people experience like cramping and stuff like that, right? Like things like magnesium can really help, but having a gentle kind of calming routine around an hour where you're definitely staying away from screens, but doing things for yourself, like maybe a warm bath, just like a baby, reading a book, just like a baby, to kind of signal that the day is done and we're preparing, ourselves for sleep.
That's so helpful. Yeah, I'm definitely in the book club. I love it. It's so funny. I've seen too on like Instagram, not doom scrolling, my allotted time I give myself, but just doing hobbies for yourself that you used to do as a kid or a teen. And for me, that's reading. That's definitely helped my sleep. I look
Mhm.
forward to it. I'm going to read a few chapters. And honestly, if I can't even hit 30 or 45 minutes reading, I put my Kindle down and I fall asleep. Like it's that soothing to me that I'm like, nope, I can pick it up later.
Yep.
I
Yep.
think that's so important that, I'm getting enough me time and I'm excited to get some sleep because it's
Yeah.
definitely important.
Yep, because you're creating those positive sleep associations with that like consistent routine that really kind of like prepares your brain for bedtime, and journaling. That's one thing that adults
Oh,
can do that
yes.
babies can't.
Yes.
But that's another thing I'm a big fan of too, especially if you have a busy mind at night.
Mhm.
So yeah, oftentimes for bed, I'll do a little bit of journaling to kind of like process my thoughts, and do kind of like, some magnesium lotion, like a body scan or another kind of mindfulness exercise, or, very gentle stretching or movements for sleep. I think having a routine like that or something like that that kind of has those positive, associations and cues your body to prepare for sleep, and not just your body, but your mind too. Cause that's really what sleep is for. Sleep is really for your mind.
Oh, so important, especially for the new moms or the moms who just have one kid, right? Who
Yeah.
it's constant all day making. So I feel like that people told me that, like, oh, you start making decisions, like it just amplifies, right?
Uh,
But it's so true because you're picking out from the moment they open their eyes, there's a choice to be had. Do I get them up now? Are they calm right now? Okay, get them up. Time to change diaper. What are we gonna wear today? What's for breakfast? And it just
totally.
never stops ever.
Yep.
Like it just never stops. So I love that you said that sleep is for the mind. One more question before we talk about more fun stuff about you. But what are some red flags in terms of not getting enough sleep? So I know you mentioned quite a bit, but would it be, and basically, I love that I've had in my two girls that I have my first one, horrible sleeper. Second one, a
Mhm.
champ. So this episode really is for the moms too, who maybe they don't have the greatest sleeper.
Yeah, I
And so
know.
it's
There's a
hard to
big
set up
difference,
that.
the baby that you get, right? Like people get
Yes.
like colic and like,
Hmm.
but yeah, baby is, and this is another kind of big risk factor for perinatal mood and anxiety disorders, like your baby and like what kind of baby
Yes,
you have. And if you have a baby with
absolutely.
colic, or if you have a baby that's, having issues with feeding or issues with sleeping, and especially the sleep part, right? If that's, disrupting your sleep, it's going to have a bigger impact on you and your own mental health for sure. Yeah.
Absolutely. And so I guess for past the newborn phase, we're looking at maybe 10 months on, right? 10 months, a year where the baby really should be sleeping normally and baby is sleeping normally. What are some red flags for moms that you would be like, I think we should reach out to some expert, maybe get on medication, maybe get tested? What are some red flags that you might have mentioned earlier, but just lay them out one more time?
Yeah. Yeah. I think, generally, of course, like the newborn period is going to be hard and your sleep is going to be disrupted. But certainly as your baby gets older, they should be sleeping longer stretches of time. And, we haven't mentioned like working with a sleep consultant, but
Mm-hmm.
if you're experiencing, past kind of the newborn days, a lot of difficulty with your baby kind of sleeping, and that's interfering in your sleep and that's impacting your mood and your ability to function, definitely I think reaching out to a sleep consultant can make a big difference. And similar to that, right, we mentioned, and I know it's not the topic for today, but feeding difficulties can be another source of stress. Reaching out to like lactation consultants or other kinds of like feeding specialists if that's a source of anxiety. And they say that eating and sleeping are connected, right?
Mm.
So reaching out to those kinds of sources of support too can make a big difference in the
Yeah.
postpartum period. And the postpartum period, psychologically speaking, is a year. It's not, 6 or 8 weeks like
Mm.
in the medical model
Hmm.
where they're really just looking at kind of a physical recovery from childbirth. Psychologically speaking, it is a year. And a lot of moms, I think, don't really feel like themselves until maybe closer to a year and a half or even 2 years. It takes a long time to get your pink back, as they say, or your sparkle back.
Absolutely. I would so agree too. And I breastfed both my girls, the first one for 2 years, the second one,
Mhm.
she's 10 months, so I'm still breastfeeding. And I don't even have my cycle back. And I got my cycle
Yeah,
back pretty late with my first because she was draining me completely. But with my second, I feel like I'm eating well, I'm getting outside. You
yeah,
definitely become a lot more confident when you have more kids, obviously. And I still don't have my cycle back. So I love that you mentioned that because I feel like for a lot of women, myself included, you forget. You think, 4, 5, 6 months, like, okay, I'm good. But no, my body is still healing. My mind is still healing,
totally.
still
And
adapting.
it's really important that are prioritizing not just your sleep. Your sleep is really, really important, but then also kind of like, are you drinking enough? What is your like
Yes.
nutrition like? Because you're asking your body to do so much when you have a baby. It's so demanding, it's so depleting. So you really want to make sure that you're supported. And a big part of that is getting rest, especially when you're recovering postpartum. And recovery is kind of a long process, really, not just 6 or 8 weeks, but beyond that, far beyond that. So you want to make sure that you're nourishing yourself as well. Part of that's through sleep and part of that's through diet and, maybe kind of like movement. And I would add even like social support and connection is nourishing. All of that matters.
Oh, yes. I love social yeah, the play dates that come after becoming a mom are, like, the best, honestly, and just a place to just talk to, resonate with, vent even sometimes. They really become the best. I love that you mentioned that too because, yeah, it's like a good little it fills up your cup in a different way, right? So, like, for me,
Mhm.
reading fills up my cup, but I also really love my play dates. Fills up my cup too to be with other moms with similar age kids. Yes, and we can definitely help each other with tips, right? Like, "Oh, I did this or I did that," and it definitely feels good. Yes. Okay, well, we'll keep going with this conversation, but let's take one of our last breaks. Welcome back to Newbies. We are continuing our topic. And Carissa, you have been amazing. So, one more time, tell us about your work. And I know you said that you are accepting new clients. Do they have to be local to California or Los Angeles? And I know you have a bunch of little worksheets you
Yep.
mentioned or workups
Yep.
on your website, but one more time, tell us about it.
Yeah, absolutely. So anyone, anywhere can download for free the postpartum guide that I have on my website that talks you through, ways that you can create a plan for postpartum that protects your mental health, and sleep is a huge part of that. So I would encourage anybody to download that for free. Also on my website is the online course, Reclaim Your Life After Birth, which walks you through acceptance and commitment therapy and the skills from that model or approach, which is what I use in therapy to help protect your mental health as you're, transitioning into parenthood. And yes, if you're interested in working one on one with me, you do need to be in the state of California. But if you are in the state of California, you can fill out the contact page and we can discuss working together.
Yay, that sounds awesome. And so, last real question before we wrap up this amazing episode, and I hope the mamas listening will incorporate some of this and get a good night's sleep. I'm putting it out there. But what is some advice you have for new moms who are in the sleep trenches right now? I guess I'll go first. And actually, this is something I've been thinking about for the past couple of weeks. Cause like I mentioned, I have a 10-month-old and then a 3-year-old. She's like 3 and 4 months. Anyway, and they're needing me less and less. And it actually is making me sad. I'm getting better sleep. And I'm like, I know. And everyone says this. And I kind of got irked by it, honestly, that, in the childhood phases, you'll look back on the newborn trenches, the toddler stages and miss it. And I'm in it right now. Like I definitely am in it, but I'm noticing the slight pull away. And I'm like, oh my gosh. So long story short, you might be in the trenches now. It will get better. It definitely will get better. Going to be hard while you're in it, but time does heal sleep for me at least. But anyway, what are some tips you have for the moms who are not getting sleep, excited to start their new routine, but what would you tell them?
Yeah, absolutely. That like you will sleep and your baby will sleep at some point, right? And like every baby's maybe a little bit different with that. And again, like, if that's been a struggle past a certain time, maybe it makes sense to reach out to like a sleep consultant to kind of troubleshoot, but your baby will sleep and you will sleep. You're not going to be sleeping in 90-minute increments forever. You're not going to be waking up at 3 a.m. to feed or to pump or anything like that. And also, right, feel empowered to make the decisions that you need, for the highest good of your family when it comes to sleep, when it comes to mental health, if that means that you're, going on medication, if that means that you're formula feeding, whatever that might mean, prioritize meeting your needs, to support your mental health. That's going to also kind of support your family.
That is so important. I'm excited for this episode, honestly. I think it's so important. And I love talking about mamas. I mean, who doesn't like talking about babies? But mamas are so important and we do need sleep. And it will come back eventually.
Yeah.
We promise.
Yep. You will feel rested one day. This is not forever.
Yeah, no. Okay. Well, thank you, Carissa, so much for coming on. This has been a great episode. I am excited for our listeners to definitely check you out. Yay. Thank you.
Yeah. Thank you for having me.
Yay. Well, be sure to check out newmommymedia.com where we have all of our podcast episodes, plus videos and more. That wraps up our show for today. Thanks for listening. If you love newbies as much as we do, please consider checking out the amazing businesses that sponsor our show week after week. And we'd also love for you to tell another new mama about this resource, which of course is absolutely free. And if you want to check out some of the other podcasts we produce, such as Preggy Pals, Parent Savers, the Boob Group, and Twin Talks, then visit our website at newmommymedia.com. Don't forget to follow us on Instagram for more giveaways. Thanks for listening to Newbies.
This has been a New Mommy Media production. The information and material contained in this episode are presented for educational purposes only. Statements and opinions expressed in this episode are not necessarily those of New Mommy Media and should not be considered facts. While such information and materials are believed to be accurate, it is not intended to replace or substitute for professional medical advice or care, and should not be used for diagnosing or treating healthcare problem or disease or prescribing any medication. If you have questions or concerns regarding your physical or mental health or the health of your baby, please seek assistance from a qualified healthcare provider.
Hey mamas, don't forget to check out Mighty Moms. It's our online community built for new moms just like you. Not only can you connect with other moms, but you can also join us backstage for special mom-only online events. And you'll also be notified when we're recording so you can join us as a special guest. Visit our website, newmommymedia.com, and click on the Mighty Moms banner. It's free. That's newmommymedia.com. See you there.